Have you ever experienced a burning sensation in your chest or a feeling of food coming back up after a meal? While these symptoms are often associated with acid reflux, sometimes there is a deeper anatomical reason behind them. Understanding the specifics can be a powerful step toward finding relief and making informed health choices. When it comes to a hiatal hernia, which is when a portion of the stomach pushes up through an opening in the diaphragm, the two main types are the sliding hiatal hernia and the paraesophageal hiatal hernia. The fundamental difference between them lies in how the stomach moves and its position relative to the diaphragm opening. The diaphragm is a large dome-shaped muscle that separates your chest and abdomen, and it has a small opening called the hiatus through which your esophagus passes to connect to your stomach. In a sliding hiatal hernia, the most common type, the upper part of your stomach and the gastroesophageal junction, which is the connection between your esophagus and stomach, slide up and down through the hiatus. It moves in and out of the chest cavity. On the other hand, a paraesophageal hiatal hernia is less common, but often considered more serious. Here, the gastroesophageal junction remains in its normal position below the diaphragm, but a portion of the stomach, usually the fundus, bulges up alongside the esophagus through the hiatus into the chest. This distinction is important because the way the stomach moves impacts your symptoms and potential risks. With a sliding hiatal hernia, the stomach's ability to slide up can disrupt the natural anti-reflux barrier, leading to classic symptoms of acid reflux, like heartburn and regurgitation, much more frequently. Because the stomach is less likely to get trapped, symptoms are typically related to reflux. For a paraesophageal hernia, because a part of the stomach is pushing up next to the esophagus, it can sometimes become twisted or even incarcerated, meaning it gets stuck. This can lead to more acute symptoms such as severe chest pain, difficulty swallowing, or even bleeding, and it may require surgical intervention. Doctors often diagnose these conditions using imaging techniques like a barium swallow study or an endoscopy, which allow them to visualize the stomach's position. While sliding hernias are frequently managed with lifestyle changes and medication to control reflux, paraesophageal hernias are often watched more closely due to their higher potential for complications, and surgery might be recommended even if symptoms are mild, to prevent future issues. Recognizing the difference helps both you and your healthcare provider understand the best approach to managing your condition. Knowing whether you have a sliding or a paraesophageal hiatal hernia provides crucial insight into the nature of your digestive discomfort. It allows for a more targeted treatment plan, whether that involves simply managing reflux symptoms or considering interventions to prevent more serious complications. This understanding empowers you to work effectively with your doctor, leading to better outcomes and an improved quality of life.